Hello everyone, my name is Natalie Tejeda and my group and I will be presenting on cervical cancer. So we are part of the UC Riverside Future Physicians Leaders Summer Program. Our goal is to bring awareness on cervical cancer to the Inland Empire. We are both passionate about women's health and cancer in general, so we combine both of these ideas to spread awareness on cervical cancer. Next slide, please. So we are part of the Riverside and San Bernardino cohort. Leslie would now be introducing herself.
Hi everyone, my name is Leslie Adame and I'm from Norte Vista High School. I'll be graduating in the year 2022.
Hi everybody, my name is Anta Wing and I'm a second year biology major at UC Riverside and I'll be graduating in 2024.
As I mentioned earlier, I'm Natalie. I'm an incoming fourth year majoring in neuroscience at UC Riverside, class of 2022.
Hi everyone, my name is Sandra Vergara. I'm an incoming fourth year at UC Riverside. I'm currently majoring in neuroscience and will be graduating in the spring of 2022.
Hello everyone, my name is Jason. I'm an incoming second year at UC Riverside, majoring in microbiology, and I'll be graduating in 2024.
Hi everyone, my name is Teresa. I am a fourth year cell and molecular developmental biology major and I will be graduating in the spring of 2022. Now Sandra will talk about the pre-survey.
If you could please take a few minutes to fill out the pre-survey, we would really appreciate it. Please feel free to pause the video when you want.
So now we're going to talk about the learning objectives of this presentation. So our first learning objective is to help you become more knowledgeable about cervical cancer. Our second learning objective is to help you apply prevention techniques to address cervical cancer risks. And our third learning objective is to help you use and identify prevention and treatment resources. And our last learning objective is to help you address stigmas behind cervical cancer. Now Sandra will give a quick disclaimer about our presentation. Next slide, please.
We do want to emphasize that the information on this presentation is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. All content, including text, graphics, suggestions, images, and information contained on or available is for general information purposes only. You're encouraged to review all information regarding any medical condition or treatment with your physician. Never disregard medical available advice or delay seeking medical treatment because of something you have read through this presentation. Now, Anne will be giving us a few statistics. Next slide, please.
Hi everybody, I'll be talking about the staggering statistic about cervical cancer in the United States. So a little bit less than 14,500 new cases of cervical cancer will be diagnosed in 2021. And even though cervical cancer is not widely talked about, it is actually the fourth most common cancer found in women. And in 2021, a little bit over 4,000 women will die from cervical cancer in 2021. Now, Leslie will be talking about the importance of cervical cancer.
Thank you, Anne. So although cervical cancer is important for several reasons, I want to address the three most important. The first is to gain the ability to identify cervical cancer in its early stages. This is important in order to find treatments. The second one is to prevent abnormal cells from developing into cancerous cells. And later on in the presentation, we will talk about preventative measures. And the third reason, so cervical cancer is important, is because it determines whether or not a life will be healthy or not. And being able to identify and prevent will ultimately reduce the chances of death. Now for our next slide, Jason will be talking about stigmas and barriers.
Thank you, Leslie. So there are many incorrect stigmas that people believe about cervical cancer. One prevalent stigma is that people with cervical cancer all have had multiple sexual partners, which isn't true. People who've only slept with one partner can get cervical cancer through HPV. There are also many barriers in our society preventing people from understanding and talking about cervical cancer, such as some people think they'll be perceived as unclean, so they don't want to live with the fear of coming out and telling people they've been diagnosed with cancer. In society, there are also economic barriers. A lot of low-income women don't have access to healthcare services like Pap tests, HPV tests, or general health checkups, so they lack knowledge on cervical cancer and what it is. There's also a gender barrier. Since cervical cancer doesn't affect males, many males never really talk about it. So that contributes to the lack of awareness for cervical cancer. So as a community, we need to bring more awareness to this topic and talk more openly about it so we can continue to grow and live healthier lives. Now on to Anne, who will talk more about cervical cancer in the US and California. Next slide, please.
Thank you, Jason. So I'll be talking about the statistics in the US, California, and specifically within our community. Nationally, on average, 8 cases of cervical cancer per 100,000 females of cervical cancer are diagnosed per year. And even though the mortality rates have been decreasing by more than 50% over the last 30 years, with more awareness, the mortality rates can definitely decrease even lower. Specifically in California, Hispanic women have the highest risk of developing cervical cancer. They have 1.5 times more of a risk of developing cervical cancer than white individuals or Asian/Pacific Islanders. Specifically within our county, Riverside, San Bernardino County, there were 8.4 cases of cervical cancer per 100,000 females. This is a little bit over the national average, so it shows that cervical cancer is definitely a big problem in our community. Now I'll be talking about what exactly is cervical cancer. Cervical cancer is the uncontrolled cell growth within the cervix, and it usually affects women between the ages of 35 to 44. So now you're probably wondering, what exactly is the cervix? The cervix is a narrow tube that is the bridge between the uterus and the vagina. Now, Teresa will be talking about the causes of cervical cancer.
So what causes cervical cancer? And what we found out is that about 99% of cervical cancer cases are caused by sexually transmitted human papillomavirus, which is HPV. And HPV is a viral infection that's passed between people through skin-to-skin contact. And however, not all infections result in cervical cancer. And so I want to highlight here on the left that it shows that 80% of men and women will be infected with HPV at some point, at some time. And as I was mentioning, 80% of men and women will be infected with HPV at some time. Now, Leslie will further talk about the relationship between HPV and cervical cancer. Next slide, please.
As Teresa mentioned, HPV is the leading cause for cervical cancer. So taking this in mind, did you know that 1 in 10 women with high-risk HPV will be at risk for cervical cancer as well? So also taking in mind that 80% of women will be infected with HPV at some point in their life. So this is a drastic number, meaning that like 1 in 10 women from those 80% will be having cervical cancer. For our next slide, Anne will go over the stages of cervical cancer.
Thank you, Leslie. So now I'll be talking about the stages of cervical cancer. Before I talk about the stages, I wanted to just point out the different parts of the female reproductive system. So you can see that there's a cervical canal, the cervix, the vagina, the cancer tissue that is forming in the cervix when a female has cervical cancer, and then this may lead to bleeding. And below is a little diagram that shows the different stages. So what exactly is a stage? A stage of cancer describes how far the cancer has spread throughout the body. The stage is one of the most important factors in deciding how to treat the cancer and determining how successful the treatment may be. So this shows all of the stages in the beginning. So there are exactly 4 stages of cervical cancer, and the 4 pictures listed here are illustrating the beginning stages of the cervical cancer. As a rule, the lower the number, the less the cancer has spread. A higher number, such as stage 4, means a more advanced cancer, and within a stage, an earlier letter means a lower stage. Now, Natalie will be talking about the signs and symptoms.
Thanks, Anne. So most women don't notice the early stages of cervical cancer, which makes diagnosis very challenging because we might confuse it with our normal menstrual period symptoms. However, when the cervical cancer is advanced, this means the cancer is large and it goes into nearby tissues. The most common symptoms include pelvic pain or pain during intercourse, bloody vaginal discharge that may have a heavy or have a foul odor, vaginal bleeding after intercourse, between periods, or after menopause. Jason will now be going into the risk factors.
Thank you, Natalie. So HPV is the most common important risk factor linked to cervical cancer. More than 9 out of every 10 cases of cervical cancer are caused by HPV. Smoking, another risk factor, exposes the body and all its organs to many cancer-causing chemicals, harming the immune system and making it less effective in fighting off HPV infection, causing women who smoke to be twice as likely as non-smokers to get cervical cancer. Many characteristics of someone's sexual history can contribute to increasing the risk of getting cervical cancer because of increased exposure to HPV, such as becoming sexually active before age 18, having sexual intercourse with several partners, and having 3 or more children. When it comes to HIV, it severely weakens the immune system, making the body more susceptible to getting an HPV infection, leading to cervical cancer. The social determinants of health are the economic and social conditions that influence individual and group differences in health status. Economic standing is the one that affects cervical cancer, since many low-income women don't have easy access to adequate healthcare services like cervical cancer screening. They may never get screened or never treated for cervical cancer. And in the case of dieting, many women who don't eat enough or have access to vegetables and fruits will also have a greater risk of developing cervical cancer. One last risk factor is birth control. There's evidence that people who take oral contraceptives for more than 5 years have a higher risk of developing cervical cancer compared to those who've never taken any. Now on to Leslie, who will talk about what happens if cervical cancer is left untreated. Next slide.
Before going into treatments, I want to address what would happen if cervical cancer is left untreated. There are 4 major consequences, the first being infertility, which eliminates all chances of pregnancy. This is severe for women who plan to have a family in the future. The second one is reoccurrence, or when the cancer appears once again. This can be dangerous considering that cervical cancer is often fatal and treatments may be expensive for some communities. The third one is malfunctions or complications with sexual, bowel, and bladder functions. This proves that cervical cancer doesn't only impact the cervix, but other parts of the body, making it difficult to combat one problem at a time. And lastly, HPV, which we already know is the main cause of cervical cancer. So not only does it develop the cancer, but also general warts, and it continues to stay in the body. For our next slide, Sandra will go over the treatments.
Thank you, Leslie. So here we have some of the treatments that a person can go under if they do have cervical cancer. We have surgery, targeted therapy, chemotherapy, immunotherapy, and radiation therapy. To start off, a person can undergo a conization surgery, which is when a physician abnormal tissues from the cervix. A simple hysterectomy is when the uterus and the cervix are removed. As for radical hysterectomy, this is when the uterus, along with tissues next to the uterus, the cervix, and about 1 inch of the upper part of the vagina is removed. Then we have targeted therapy, which is when a certain type of drug is given to stop tumors from forming new blood vessels and continue on growing. And then we have the next type of treatment is chemotherapy, which involves the use of anti-cancer drugs that are injected into a vein or given by mouth. And immunotherapy helps stimulate the immune system to target and destroy cancer cells. And finally, there's radiation therapy, where external beam radiation aims X-rays at the cancer from outside the body, while brachytherapy puts a source of radiation near or on the cancer. Next, I'll be talking about some of the ways you can prevent cervical cancer. Next slide, please. These are the 3 main ways a person can help prevent the development of cervical cancer. The first one is getting the HPV vaccine. Vaccination can be started at the age of 9, and this also applies to males. HPV, as we said, is one of the leading causes of cervical cancer, and the vaccination can help fight it if you're infected with it. Avoiding smoking is also really important, because if you do contract HPV and you smoke, your body won't be able to fight off the infection as well. And lastly, getting screened for cervical cancer is really important. As displayed by the chart below, you want to start getting Pap tests at around the age of 21 to see if there are any abnormalities. Then between the ages of 30 to 65, you should be getting a Pap test and an HPV test, or a Pap and HPV test, which is also known as a co-test. Additionally, you want to continue on getting screened until you're about 65, and typically you can stop getting screened around this age if you've had normal tests so far. Next, I will be talking about some resources that can aid in preventing cervical cancer. So regularly visiting a physician can reduce your chances of getting sick, so we wanted to provide some resources that can help you get connected to health insurance. Covered California is where you can start, actually. It's a free service that helps people get connected to health insurance, such as Medi-Cal, which is a health insurance program that serves low-income individuals, families, seniors, and even people with disabilities. Two programs that people are able to select under the Medi-Cal program are the Inland Empire Health Plan and the Molina Healthcare Plan. Additionally, it's important to eat enough of healthy foods that will keep your body strong so it's able to fight off any infections and/or illnesses. If you are experiencing food insecurity, CalFresh is just one of the many programs available that can help you get access to healthy and nutritious foods. If you would like to learn more about these programs, please feel free to check out our website. A link will be provided towards the end of the presentation. Now, Teresa will be talking about some resources available to the public. Next slide, please.
Thank you, Sandra, for pointing those resources out. First, I want to highlight that always seek a medical professional before starting any new treatment. And now I want to start by saying these are just some of the resources that we found. We have more on our website, so please feel free to check our website out. So right here, we have these local resources that we found called Loma Linda University Health, Inland Empire Women's Center, and Clínica Médica Familiar. And these resources can help you with cancer, cervical cancer screening, finding preventive ways and how to avoid cervical cancer, and just more helpful tips for your health. And we also included here some apps that might also help learning more about cervical cancer and HPV, and just helping keep track of your health, and just helpful tips for your health. And also we included these extra resources, and Cervical is an online support group that you can check out, and I really recommend it. We provided a further description on our website, so please feel free to check that out. And lastly, I want to mention this program called Every Woman Counts. It's a program that offers free breast cancer screening and cervical cancer screening for the vulnerable population. So please feel free to check our website out for further information. Now I will talk about the post survey. Next slide, please. Okay, and so I want to ask you to please take a few minutes to fill out the post survey. You can either pause the video or just take a few minutes to fill this out. And Jason has just inserted the post survey link right there. Thank you. Next slide, please. Now, Natalie will ask if you have any questions.
Thank you, Teresa. So I'm sure you might have some questions regarding our presentation or cervical cancer in general. So if you do have any questions, feel free to email us or follow us on your social media platforms. We also have our website where you can check out more information.
Now, please remember to check out our website. As I said, this is the link in the QR code. Next slide, please. And also, please visit our YouTube page to watch informational videos about cervical cancer and treatment and more. And right here, we've provided the QR code for you. Next slide, please. And also, please don't forget to follow our Instagram page, where we will be updating it with more information about cervical cancer. Next slide, please. And also, we've created this GoFundMe page because we want to be able to create this to help our community out. And so all these donations will go to the Women's Cancer Resource. Anything will help. Our goal is 200, but anything will help. But please don't feel obligated to donate anything. But if you can, please donate to our GoFundMe page. Okay, next slide, please. And now we just want to thank you all for listening to our presentation. We would especially like to thank Esmeralda, Jacqueline, Heidi, Zubia, Naomi, and the UCR FPL program for making this project possible. It has been such a great honor and privilege to be able to bring awareness about cervical cancer to the community. And I just want to say thank you. And also don't forget to follow our Instagram, our YouTube page, and check out our website. Thank you, everyone. Bye.